Dr. Joseph Reuben of AdventHealth is joining us this afternoon. Thank you so much for being here. He's a past medical director in the ER and immediate past president of the medical staff. And really important, he is a graduate of the 2019 leadership program of Northeast Johnson County Chamber. So Dr. Reuben, tell us what's going on right now.
Well, thank you so much, Deb, for having me and letting me share my experiences with all of you guys. I also first want to start off is to thank Deb and the Chamber of Northeast Johnson County Chamber for your guys' leadership and helping us through this difficult time. I know it's a hard time for business, so thank you for helping guiding us and helping raise awareness. Also, too, I want to thank the business community. You know, we've got an outpouring of support at my hospital, AdventHealth, Kansas City. We've got donations of PPE. We got food donations. Our foundation was a lot of monetary gifts were given to us and given to our frontline workers to help us through this crisis. So I want to say thank you to all the business community out there for the support of my hospital and AdventHealth, Kansas City. I also want to say to the business community, you know, as I'm a part owner of a physician practice, and you know, I get it. This has been a hard time, and it's been very difficult on our businesses, especially the small businesses, getting us through this time. So thank you for everything you guys are doing and helping us get through this. And most importantly, I want to say thank you to the community. You know, early in March, we started hearing all these stats and data that our ICUs are going to have, I don't know, 90 people in the ICU ventilated for weeks, and our ERs are going to be overrun. And some of these stats, we were worried that we were going to become the next New York. But really, we all came together as a community, and Kansas City community together, pulled together, and we were successfully able to do this social distancing, and we're able to flatten the curve. And our hospital, our ER, were able to meet the challenges. It did not go above the capacity of what we can care for. And that's due to the great work and the social distancing that we did as a community to prevent this virus from coming too widespread. So I want to say thank you also to the community. And yes, right now we have a very manageable rate of infection rate, and we flattened the curve, and we were successful at it.
So Dr. Reuben, we flattened the curve. Now what?
Yeah, great question. And that's why I guess we're all really here. And, you know, we want to open up. We want to open up safely because we don't want a huge peak just to be delayed. So it has to be done very wisely. It has to be very more nuanced. I would first say for everyone's individual health risk, please talk to your primary care doctor. Also, there's been a lot of work by the county and the state. Look at their websites, follow their recommendations. They are good ones. So I would say anything that I say supersedes, it does not supersede what they're saying. So please listen and refer to them. I just wanted to give some general tips and some general guidelines so we can open up safely and we can be successful as we were in this first part of it. I would say in general, it is safer the more less contact you have and the more isolated you are, the more safer you are. That is certainly true. And I would say people that have comorbid conditions, people that have advanced age, people that take a lot of medicines, that have morbid obesity, high blood pressure, diabetes, cancer, that have immunosuppressed, please continue to social distance because you are safer. There are a fair number of people that harbor the virus and contagious and do not have symptoms. So the people that are high risk continue to social distance and is always safer. The other thing too, I would say is that people that can successfully work from home and do it well and it doesn't compromise and they are able to work from home, please continue to do so. I think that's wise. And the more social distancing we do, the less likely the virus is to spread. Now, there is some people now, as the businesses start to open up, people have to be out there. There are some certain guidelines that we should continue to follow. And these are very important for us to continue. Continue to stay 6 to 8 feet away from each other. Frequently hand wash. Don't touch your face. Stay away from long-term care facilities, memory centers, and communities with elderly people. And stay away from large crowds or groups. Try to stay far away as possible. And the other thing too is our community has a very low incidence compared to other communities. So unless it's absolutely necessary, I would say travel is not recommended. And the other important thing to remember too is that if you do feel ill or you do get flu-like symptoms, is stay at home. Not only stay at home and stay away from the community, but stay away from your family members. That's very important. And the other thing too, I think masks are probably a good idea. And just a quick word about masks. Treat the mask as if it has the virus, meaning that when you take it on and off, don't touch the front of it. And then after you touch it, don't touch your face or your eyes. And frequently clean them and make sure they're dry, maybe have more than one. But I think wearing masks are also probably a really good idea. So when you're out in public, continue to do the universal precautions of keep the social distancing, wash your hands, don't touch your face, and if you can stay home, please continue to do so. So as we start to open up, please follow some of those guidelines.
You talked a little bit about calling your doctor. Is it safe now to see your doctor, to go to the ER, to go to a clinic?
Absolutely. Absolutely. At AdventHealth Kansas City, we're doing every precaution and going over and above to making sure that the areas are all sterilized. We are making sure that people that do have COVID are separated from non-COVID patients. Anybody with any respiratory symptoms, our ER has them in a different wing while they're being worked up. So we're going over and above to make sure it's safe. The clinics and doctors' offices are also doing that. Also. Unfortunately, what I'm seeing is a lot of people that are nervous to come to the emergency department or come to see their doctor. We're seeing them later in the course of their disease, and it's much harder to treat them then. For example, if you have abdominal pain, I'd rather see you before your appendix bursts. So come into the emergency department. If you get injured or you're ill, it's safe to come see us. It's safe to see your doctors. So please, that's a great point. I'm glad you brought it up, but yes, absolutely.
One of the other things that we're hearing a lot in the community is the testing. So who should get tested and where do they go to get tested?
Well, I can only speak for my hospital and at AdventHealth Kansas City. We're very lucky that in our emergency departments and all of our primary care outpatient clinics, we are able to do testing, and we have very rapid turnaround times between 12 and 24 hours for patients that are able to go home. Patients that obviously that need to be admitted, we can get the results a lot quicker. But if you do have symptoms, we can test for you. But really what's more important, I think even more important than testing, is the behavior and what we do after the test. If you feel ill, you should stay home, stay isolated, don't be out, stay away from your family members so they don't contract the disease and don't spread it. So the action we do, whether the testing is positive or negative, is actually more important. So please, if you do test positive, what I am recommending is that people self-quarantine, self-isolate themselves. And that is actually more important than the positive or negative test result. But at our facilities at AdventHealth, we do have capabilities for testing.
Dr. Reuben, it's allergy season, and a lot of us are sneezing and coughing out there. Yeah. And it's hard with everything that's going on with COVID-19. So is a fever one of those things that you must have before you come in to have a test?
No, not necessarily. I think a good percentage of them do. Let's say 30% of people have fevers with this, but not everybody. And that's one thing that makes it real challenging with COVID is the symptoms are pretty vague. You have profound weakness, You can have a dry cough. Fevers tends to be one. If you start to feel like really bad muscle aches, but they're very non-specific symptoms. If you do have allergies, please take your allergy medicines, your Claritins, because it is confusing, and I know that but it's in this time during this crisis, we have to use overabundance of precaution. So if there's any worry in your mind at all, please isolate yourself.
Good to know. Thank you for that. Along with the scare of the COVID-19 also comes the a little bit of sadness in not being able to do what we are usually able to be out and doing. So do you have any tips for us to stay healthy, not only physically, but mentally?
Yeah, great, absolutely great question. And it is tough. You're right. These are tough times on everybody, not just frontline healthcare workers, business employees, families. My wife's having to, homeschool the children. The kids feel cooped up. So these are really hard times for all of us. Some general recommendations I would recommend everybody is be good to each other. We're all going through this together. Everyone has a struggle out there, but we're in this together. We're a strong community, so support one of each other. Be good to each other. The other thing I'd recommend too is stay connected. If it's a phone call, writing letters to people, Zooming or FaceTime, please connect with other people, old friends, especially people that are living alone. The other thing I'd recommend also is every once in a while, take social media and TV breaks. Let your mind get away from it. Take long walks, stay productive. It's important also to stay thankful, and I think to pray. I think that's very meaningful. And check on your neighbors, especially elderly people. Make sure they're able to get their medicines. Make sure people can get food. And the other thing I want to say is support our local businesses, especially our small businesses. Continue to get carry out, buy gift cards from them now that you can spend later, but do support our local small businesses. And the other thing too, if you are blessed to spend more time with your family, use the time wisely. It's kind of nice. Take walks, spend time with your immediate family. But those are some general tips because these are tough, difficult times for everybody.
No, I could not agree more. So we had one question. Is it safe for us to travel now?
I would say unless you are as an absolute necessity that you have to travel, at this point, I would recommend not to. Because one of the blessings that we have and we've successfully as a community done is the social isolation is our numbers are a lot lower than other communities. And there are other communities that have higher rates of this. I would say unless it's absolutely necessary, I would not at this point recommend it.
So Dr. Reuben, I have another question.
Okay.
I understand it's not safe for people in their 60s, 70s, and older, as well as those with health issues, to leave home if they don't have to. However, if it isn't safe until a vaccine is created, and that is going to be sometime next year at the earliest, is it realistic not to see family and grandchildren and others that don't live with you for that long? What recommendations or suggestions can you share?
Yeah, that's a great question. And that's a really, tough one. I would say at this point, because we're in the business right now of saving lives. And the people that are most affected by it are the people with comorbid conditions and the older age. And this is a very bad virus. It affects the lungs, affects the heart, and people are sick for a prolonged period of time and very sick and do have deaths with it. So I'd say as a physician, looking out for the welfare of my patients and community, if you're advanced age, I would not recommend going out. And if you do go out, do the universal precautions, and that will help prevent you from doing it. But it's important to the universal precautions with wearing the mask, keeping social distancing. I wouldn't say it's absolute, with some interaction is important. My parents, for example, are older, and we visit them, but sometimes there's a few glass. We keep the door shut and we go visit them, and they kind of see us from a distance. So there's some interaction where maybe they're in the garage and I'm in the driveway. So there is some human interaction, but it's not very close. Those kind of things I think are safe. And of course, wear the mask. But it may be some time before there is a vaccine, and we're hoping as time goes on, we learn more treatment options and we learn how to make this better. But yeah, it's tough. Good
So
question.
this is the next question: is how are you treating COVID-19?
Well, we're doing major supportive care. So a lot of these people need oxygen. A lot of these people they need supportive care. We're doing a lot of supportive care. There are more treatment options while people need to be hospitalized get, and there's specific drugs. My hospital is able to give people antibodies from people that have already combated the disease and survived it. That's being tested. There's a lot of other medicines that are being tested also too. But right now, and that's one of the reasons why we're saying overabundance of precaution, is because the treatment options we're still learning.
So are there any other questions? If not, I'd like to ask Dr. Reuben, would you give us some final thoughts? And if some questions come up while you're doing that, then I'll jump back in with those. But give us some other thoughts, Dr. Reuben.
Okay, great. The first thing I would like to say for anyone that is ill now or fighting the disease now, you are my thoughts and prayers. We've seen a lot of people at my hospital and healthcare facility that survived this, even people that had to be intubated for quite a long time that were able to overcome this. So if anybody is ill watching this now or has family members now, they have my thoughts and prayers. And there's a lot of people that are surviving this. So continue, please, to battle on. I also want to make mention of the Reach Foundation and other philanthropies that have supported the Kansas City Regional COVID-19 Response and Recovery Fund. This is helping our safety net clinics, as a lot of people are becoming unemployed and losing health insurance. These vulnerable populations, this is very important. I thank you also, the business community, that helping to support this. So thank you for that. I again want to thank the people that have supported our foundation. This battle is just now beginning. Please don't stop supporting our foundation. This is a time of need. So thank you for that. The other thing I want to acknowledge is my fellow coworkers and hospital staff and doctors. I've always been really proud and a champion for doctors and very proud. But I just want to say now that I'm not just proud to just be a doctor, but I'm also proud of all the frontline healthcare workers, the respiratory therapists, the hospitalists, the pulmonary doctors, the primary care doctors, the pediatricians, everyone that's helping to fight this disease, the nurse practitioners, our APCs, the PAs, respiratory therapists. I'm really proud of you guys. Everyone came to work with a lot of fear in their brains, but they came really strong, and I'm just so proud to see everyone working and pulling together to fight this disease. And the other thing I want to say is how proud I am to be a Kansas Citian, and how proud I am to live in Northeast Johnson County, and how successful our community was to keep this disease at a low minimum rate.
Oh, I so agree with you. We did a good job of listening and staying home so that we could keep the numbers down. Dr. Reuben, we did have one other question come in.
Great.
So we talked about masks being important to wear. What about gloves?
At this point, I'd say as long as you're doing good hand washing and as long as there's no break in your skin, I kind of personally think it's overkill. And if you wear gloves for very long, it doesn't work really well. So I think, for our business community and everyone out there, good soap and water is more than enough. If you have hand sanitizer, even better. But to me, I think just that's plenty.
Okay. Do we have any other questions before we sign off with Dr. Reuben today? Well, I just want to tell you a heartfelt thank you, very sincere appreciation for what you and all the doctors around the country are doing. And not just the doctors like you were mentioning. You know, I think about the people that are going in and cleaning the rooms and the people that are there preparing food. And it's amazing how you put your line out on your life out on the line every single day to help take care of all of the people that are getting sick. So thank you so much. It did seem like maybe there might have been one last question, and I don't know if I can
Also,
get
thank you to the grocery store workers, the delivery
to
people, and the house cleaning staff, and our people at our hospitals, and everyone
absolutely.
that has to be out there, our police, our firefighters, everyone that's continuing working on to this crisis. Thank you for all you do.
All of the first responders
First
really
responders.
deserve a great hand of appreciation. So we are so glad that you were able to join us today. I think you gave some really good information that is just really easy to understand for all of us to go forward and use. And Advent Health is such a great member of the NEJC chamber and all of the people that work at the great hospital. Thank you so much.
Thank you.